is OET Writing Week. It's Monday. We're at the beginning of our journey. We're going to look at some case notes, which I don't think many people have done before. I don't know these case notes that well either. So I think we can have some good discussions today, even arguments. We can have those today about these case notes. In this, just to be clear for everyone, what we're going to do today is we're going to focus on planning the letter. We'll do that all class for 1 hour. And then the homework will be to write part of the letter. And then for the rest of the week, I'll be asking you to write paragraphs, specific paragraphs of this letter that we plan. Okay, so it means that you get a chance to really practice each aspect of the letter. Can you guys see my document here? Hope you can all see that there.
Yes.
Yeah, if it just check it's the correct one. What do you see here?
Smiley.
Smiley.
Okay, so we're on the right document. Let's just do a bit of a warm-up. Okay. Let's do a speaking warm-up. Okay, and this is a game, basically, just before we start. The game is, what does Alan do wrong? Okay, what does Alan do wrong? I need a patient. Would anyone like to be my patient?
I could be.
Fantastic, thank you, Marilla. So we need a condition for Marilla. I'm the doctor, okay? What does she have? What's her problem?
Stomachache.
Some simple stomachache. Okay, so Marilla, are you ready?
Yes.
Okay, so guys, I'm going to do like an OET speaking dialogue with her, just as a game, right? You guys tell me what am I doing that's wrong? What mistakes do I make? Okay, so here we go. 3, 2, 1, go. Hi, Marilla. Nice to see you again. Please sit down.
Hello, doctor. Thank you.
Hi there. I can see from my notes that you have recently had a stomachache. So how are you feeling today?
Oh, thanks for asking. I'm still not so good. The pain is going and it's coming all the time, and it's I don't know. I still have them for 3 days, and I'm a little worried.
Okay. And how long does it last for?
I have them for when the pain is coming. It's like 30, 40 minutes.
Okay. Well, I'm sorry to hear that.
Quite intensive.
Is it? Okay. Are you getting much sleep at night?
No, because I have them, like I told you, every day. I can associate. I can predict when it's happening. It's just coming even on the nights. I have it's actually like cramps.
Okay. All right. Stop there. So thank you. Some good acting from Marilla there. What did I do wrong, guys? Maybe more than one thing.
Empathy.
Lack of empathy.
Ah, but I said I'm sorry to hear that.
You said sorry. Okay, you didn't introduce yourself.
But I know the patient already, right? Because I said, hi, Marilla, nice to see you again, right? Sometimes you know the patient. It is to do with empathy, guys. I did say I'm sorry to hear that, but what was wrong?
It was too late.
It was too late, right? The first time she complained, what did I do?
You asked the question.
Ask the question.
Responded with quite a cold question, right? I think in OET you'll lose marks for that. Anytime the patient complains, you should give some empathy. So I only did it once, but I should have done it twice. Right? Marilla, did I make you repeat yourself as well when I asked you about sleeping? Did you already say that?
No.
Oh, right. Okay. I thought I wasn't listening to you. Okay. Let's try this again, guys. We're going to do one more. You tell me what I'm doing wrong. Ready? Here we go. And I'll show you what it is. Let's imagine I don't know the patient. This is what I'm going to say. So 3, 2, 1, go. Hi there. Please come in.
No, thank you.
Hi. Can I just confirm your name, please, before we start?
Yes. My name is Alina Mirela.
Fantastic. And may I call you Alina?
I would prefer if you call me Mirela, please.
No problem. Okay. So, Mirela, how are you feeling today?
In general, I'm good, but I'm a little worried because I have some stomach ache, and they are like cramps. They are not so intense, but they still daily, and I don't know. I'm a little worried. I'm thinking about some problems.
Okay, well, look, I'm really sorry to hear that. That sounds really difficult. Could you tell me a bit more about that?
Yes, of course. They start after my gym
Mhm.
3 days ago.
Right.
I suppose maybe it is like because I eat something or I did some exercise to the gym, but they still coming and they are like cramps. They are coming, they are going.
Mhm.
I'm a little worried. I don't know. Maybe I need more investigation if it's something really serious.
Yeah, yeah. Okay. Well, look, I'm really sorry that you're going through all these issues, and I promise that I'll try and do my best today to help you. Okay.
Yeah.
Let's start today by discussing some of the medication that we can prescribe you, and then we can talk a little bit about your lifestyle. How does that sound?
Oh, it's good. It's good. Yeah.
Fantastic. Okay. So, do you go to the gym?
Yes. 4 times per week.
Let's stop there. Guys, I don't think there was many errors there. Did anyone hear any errors?
You didn't introduce yourself.
Introduce yourself. Introduction.
Okay, so this time I didn't know, did I?
Yes.
So, introduction. What should I have said?
You should said hello. I am the one of GP working in there. I'm Alan.
Yeah, I'm Alan, and I'm a GP in this practice, something like that. That was a big error. Okay, what else? Was there anything else?
I don't know if it's wrong. Because you asked me, can I call you Mirella or Alina? Alina, you said.
Yeah.
I don't know if it's good to say I can call you like that or how you prefer. I'm not sure.
You mean like using this phrase here? Can I call you? Or I think it was okay actually. It was fine. I said, can I call you? And then I said it was fine.
Yeah.
Any other errors, guys?
Ellen, you have told how many do you go to gym? She has already mentioned that she has pain abdomen in the gym after the gym.
Thank you.
Yeah,
Thank you. That's what it was, right?
But like you didn't listen what I'm saying.
This is one of the most common errors that doctors and nurses make, right? I said, do you go to the gym? And that was an error because she already
Mentioned it.
She already mentioned it, right? And I did it because I was thinking, what techniques did I use there? You probably saw, what was that technique, that structure technique I used?
Open to closed questions.
I used open to close, but I also used the
Menu.
Use the menu, right?
Menu.
Sometimes we're thinking so much about the technique, we forget to listen, right? I think repetition is bad. If you don't listen to the patient and they say, as I said before, right? That's a problem. Okay, so this was just a warm-up game. You guys are very good. Thank you, Roshni, for spotting that last one. Obviously, we're not doing speaking today. Tomorrow, we'll be doing some speaking at 11 p.m. Today, we're doing writing, okay? And this is the plan. We'll start off with planning the paragraphs of our letter together. It's usually fairly easy to do it, and we don't need to spend too long, I hope, okay? Then, what are we going to do, Mert? If you could just read the screen there.
Yes, I can read screen.
What's the second thing we'll do today?
Groups select relevant case notes.
Yeah, so guys, you're going to go into groups today and chat to each other, and you're going to practice selecting relevant case notes, okay? At the end, like usual, I like to produce a very detailed group plan, and then you guys will be using that plan to write your letter throughout the week. There's always homework. So what do you think the homework will be today, guys?
Writing an introduction part.
Yeah, it's usually the introduction, maybe sometimes maybe 2 paragraphs. It depends on how big the letter is.
Request maybe.
Yeah, sometimes we do that. Exactly. So let's get started, guys. Let's have a look at some case notes. Are you ready? I just clear the screen. Clear your minds. Yeah. Okay. What was the name of the patient? Do you remember?
James.
Name of Paul, yeah, Paul's son, James, not Smith though. Hopefully you'll see it here, James Smith. Here we go. Okay. Let me just get this all on one screen for you guys so you can see it.
Can you send us the case notes, please?
Yeah, that's what I was going to talk about now. So guys, if you go to the Skype group, you will see the case notes. All right. Another way to get the case notes, though, is to go to the Zoom chat. can I ask you guys all just a quick look in the Zoom chat, and you should see coming now a PDF saying Med Writing 5. Does anyone see that?
Yes.
Yeah.
Yeah.
Unfortunately, on Zoom, if you're on a phone or something like that, sometimes it doesn't allow you to see it. Can anyone not see the case notes? Do we all have them? Great. Maybe someone's too shy to tell me. So in that case, just send me an email, okay? Just say, Alan, can I have the case notes? Okay, there's my email. Okay, let's focus then on James Smith. How old is he?
56 years old.
56.
That's the
So
model.
we're writing in 2019, so 1 second, I'm just having a slight technical problem, 1 moment. He's young, right? Let's just say
15
that.
years old.
Yeah, okay. Now,
He's 15 years old.
just 1 second, I can't move this. Let me just move this over here. Okay, and I'll just quickly move this as well. Okay, so he's young. All right. What's the first thing you do when you're planning a letter, guys? What do we read first?
And
Read the task.
Context.
The
maybe.
task.
Yes,
Task.
yes.
Everyone always says the task, right? But it's not. It's
We
not
should
true.
read the first where we are.
Yeah, exactly. So could you read that for us, fella?
The context. Yeah. So you are a doctor
Mhm.
working in a respiratory unit at Bridgeford.
Yeah.
Yeah, Bridgeford General Hospital. A patient, Mr. James Smith, has been sent from the ED, emergency department, with acute respiratory symptoms.
Fantastic. So this gives us a bit of context. I think it's probably the best thing to read first. Then I tend to say, next thing, a little tip is just have a look at how many dates we're dealing with here. How many
Yeah.
are we dealing with?
1, 2,
Three.
3.
3, right?
Three.
It doesn't mean that we have to talk about all of those dates, but it's a good thing just to look at the time span at the start, just to give yourself a sense of how bad how bad it is. Then we're going to look at the writing task. So Chare, could you read us the writing task?
Yes. Using the information in the case notes, write a letter to Dr. Stark for review, Mr. James Smith.
Okay.
Review of Mr. James Smith. Address the letter to Dr. G. Stark, Surgeon, Department of Thoracic Medicine, Smithtown Hospital, Smithtown.
Fantastic. What type of letter is this, everyone?
A referral.
Is he
Referral.
right, guys? Is it a referral? Yeah, it is.
Yes.
It's
because
unusual though, because where are we writing from?
from the
emergency
ED,
department.
from the emergency
Yeah.
department.
Whereas
No.
most of the examples we have, aren't they? You're usually in your GP surgery writing to, but it doesn't matter, right? But it's important to think about where we are. All right. So this looks like a referral letter. And who am I writing to? What's this guy's name? Dr. Stark. He's a surgeon. Okay. What's the surgeon going to do? What's the purpose of this letter?
Review his
Review.
Yeah.
So what does that mean, to review the case? Is that it?
Assessment.
Assessment.
It's assessment, isn't it? Yeah.
Yeah.
Assessment or evaluation. You could say review if you want, but it's a kind of assessment evaluation thing. Okay. So is everyone happy about the purpose of the letter? We always talk about the purpose. What does it mean, the purpose of the letter?
the goal, or why do we write the letter?
The goal for, not for the writer, is it? It's the goal of the, it's what the reader will do.
To the patient.
Yeah, exactly. We'll do next to the patient. Okay. Why is that so important? Can anyone tell me what the reader will
It's
do
the
next?
criteria of the OET writing.
It's in the criteria. It's in the OET exam criteria that this must be
Clear.
immediately clear
Mhm.
in your letter. So let me ask someone new. Idil, could you say hello?
Hello.
So Idil, the purpose of the letter must be immediately clear. What does that mean?
Very clean and immediately.
Let's think about organizing our letter though. You're right, Idil, but like immediately, does that mean I put it at the end of my letter?
No.
Where should I put it?
Beginning of letter.
Right? So here's our plan, guys. We're going to make a plan. We're going to plan our paragraphs. The first paragraph is always called the introduction. I'm sure that's no surprise to anyone, but we need to be clear on the purpose, right? So we're going to ask for, you could just say a review, right? Review the case. Maybe assessment is implied with that. Okay, so I've got my first paragraph. I've planned my first paragraph, but it's a bit more complicated than that. Let's start with the sandwich. What am I going to have at the end, guys?
Request.
This is paragraphs, right? So plan paragraphs together. We're going to have the request paragraphs. What am I going to do there, guys? What's going to go in here? Requests. What do you think?
We're going to ask the reader what to do.
We're going to ask, we're going to repeat, I think. What shall we say?
Or in the,
just repeat.
yeah.
So you're going to say, please.
Provide
James with an assessment.
Yeah, review. Okay. How about this? OET say that the purpose of the letter, so review, should be immediately clear. And then they say it must be developed. What does that mean, guys? Developed.
Details. Give more details.
More detail, right?
Yeah.
So by review, we mean maybe assessment, right? Assess and evaluate, something like that. Here's case. We might just say a bit more at the end. We're going to repeat the purpose at the beginning and the end of the letter. Is that clear for everyone?
Yeah.
All right, so let's think about paragraphs. It's not normally that difficult. What paragraph should I have in this letter? Paragraph 2, what should I talk about? Is it an urgent letter? Is it urgent?
No, timeline.
No, is it?
Urgent.
Yeah. If it was
Yes, it's
urgent, I don't know if it's urgent, is it?
No.
Yes, it is urgent because acute respiratory symptoms.
So why is he going to a, okay, so where does it say urgent though? So acute.
Yeah.
Is that here? Show me,
No.
Chare. That's an interesting point.
It's
Go on.
Half of the left page. Yes. Yes. Thank you, Elena.
I don't see a, oh, there. We can talk about that in a minute. Okay, then. So I don't know if this is necessarily an urgent letter in that sense. Okay,
Actually,
it might be
patient
acute.
is in emergency department. So
Yeah, he's already there. Yeah, so he can't be about to die or
so,
anything, right? Yeah.
Yes, so it's not urgent because we write it.
Yeah, that's kind of, yeah. So and we can discuss this later as well, Sanju, as well. So assuming it's not urgent, if it was urgent, what would I start with if it was urgent?
Current condition.
Current condition here, right? But he's not, he's already in the ER. It's usually you're writing to ER department, right? ED, let's say. So I don't think I really need, I don't think I should start with the current condition.
No,
What should I start with?
He's stable, so I think with timeline.
So we'll start with a nice little timeline. Okay.
Timeline.
Okay. So, and
what urgent will be like no referral, will be like transfer, urgent transfer to surgeon department.
yeah, this is almost like a transfer because he's going to, he's almost moving from the same place to another place inside the hospital. I agree, actually. Yeah, that's where the categories don't always work that well. But we understand what's happening, right? Now, if I'm going to start with my timeline, do I need any background? Do I need a background paragraph?
Yes, we
Yes,
will. Yes, of course.
Medical history, family history.
Yeah. Because
Why is that?
because the surgeon don't have any idea about him, so we
I think
should.
he's right. I
Yeah.
think you guys are right. What's the difference between a timeline paragraph, fella, and a background paragraph?
So the timeline is the story of the current problem, of the reason why.
It's a story, isn't it? It's like a narrative of current issue.
But the background is the past medical history and include all the social.
So it's like long time ago stuff, right?
Yeah.
Long time ago. It can be social and it can be medical. Okay. Do you guys think we need a separate paragraph to talk about the situation now, 17th?
Yes.
Here it is. Well, the thing is, Roshni, do I need a separate paragraph for that, or do I need Or can I put it all into my timeline? What do we think, guys? I can't decide myself. What do you think?
Current condition.
Should we have a separate paragraph or should we put it all together?
I think separate.
Okay, I'm starting to feel that myself. I feel that myself. So you've got the classic. This is a classic doctor's letter, right?
Yeah.
It's very, very often we write this structure. We write timeline, current condition, background, requests. Now, what if the reader knows the patient?
Then no background.
We don't need background.
We wouldn't do that. Why would we not do that? Imagine the surgeon knew him already and had treated him before.
Because you already know what.
You will already know.
It becomes irrelevant.
Exactly. It becomes like it's going to go. Okay. But in this case, he definitely doesn't know him, right? So I'm going to have a background. I'm going to have a current condition. What's the date of the current condition? It's 17th of February, right? 17th. Okay. So in the exam, you need to be able to do this mentally, right? Because for the first 5 minutes of the exam, what are you not allowed to do?
I'm not allowed to write anything.
Pens down, okay?
I can, pen throw.
Yeah, so mentally, inside your head, you need to be saying, okay, I'll have an intro, then I'll do a timeline, then I'll have a current condition. Do I need a background? Yes, okay, I'll have a background. That'll be paragraph 4. I'll finish with requests, okay?
Just one question, can I do?
Please. Go on.
After we are allowed to hold the pens and write, do you advise us to start writing the introduction or to write just like this a plan?
I think if you feel like you need a bit more planning, then continue a little bit more planning, guys. Okay. Right? So it's okay to plan for maybe 6 or 7 minutes. I wouldn't mind. Because sometimes doctors have told me, I had 2 doctors have told me that they wrote half the letter and then they realized it was wrong. They made a big mistake and they had to rewrite it. So I think planning is important. Okay, you don't want to do that. What are we going to do now, guys? We've planned our paragraphs. We know who the reader is. We know what the purpose is. What are we going to do now?
We choose what the information from case note we allocate.
Yeah,
which
we have to go line by line, don't we, and decide what is it here that I need to put in. Okay, so that's what I want you guys to do now. Okay, so the next thing we're going to do, guys, is we're going to go into groups and to select case notes that we need. And you can discuss this. You'll have 20 minutes. 20 minutes for discussion. Before you do, though, I think I should talk to you about this because it's very important. How do I choose case notes? What am I doing?
We only choose the relevant things about her condition.
Okay, so let's put this here. So we select the relevant ones. What does that mean, relevant?
Which is associated with her current condition.
So associated, not always associated with the current condition. No, it might not be relevant.
What will benefit the
reader? Relevant for our letter, for our proposal?
It's relevant for the purpose, which means relevant for who?
For the reader.
Reader, right? So relevant equals
necessary for the reader.
Well, the reader needs this, yeah, something like that, or reader appropriate, right? We'll talk about that in a second. Okay, so I select the relevant case notes, and the ones that are not relevant, what do? I do not choose. What's that word that's the opposite?
Irrelevant.
Irrelevant. Is that it? Is it that simple? Is there any problems with this?
No, there another category.
Yeah, I tend to say, guys, put it in, let's have 3 categories, not 2. Yeah, you remember, go on. So relevant case notes. And,
but summarize.
Well, first one is detail, right? Also, and then we got the second one is, as Emre says, as is summarized. So Emre, talk us through this because there's people in this class who might not have seen this idea before.
Of course, some of the case notes are relevant to the reader, but we have to summarize in order to be more concise.
Yes. What does concise mean, guys? Anyone? Concise?
summarized.
Yeah, this sort of means the same thing.
Sorry.
Short, I guess is the idea.
Short.
More things
it's
in
about
less words.
Yeah, well, I mean, guys, you can't write a 400-word letter, right? That wouldn't be concise. It has to be 200, 220, something like that. They're not going to count your words, but what they will do is they'll say, is this person giving me too much information? So, so it's not clear, right? Let's have an example of that just quickly before I put you in groups. Let's use these case notes, right? This surgeon, where does he need detail? Can anyone tell me? Just give me one example. Is he going to need detail on the medications?
Yes.
Yes.
So how much detail will he need here? He'll need the names, will he?
Yes.
Of course. Will he need the dosages?
Yes.
So he will need dosages. Yes. Will he need the other stuff?
No.
I think you could probably just give the dosages, right? What do you guys think?
The surgeon already knows why we use this drug. We don't have to mention that it's an anti-seizure drug, for example, because he already knows it.
So this is what I mean by it's relevant. We're going to try to summarize it a little bit because we don't have a lot of time, right? And we don't think that every single detail here is necessary. Does that make sense? Okay. The opposite could be true. It might be the case for some readers that they need absolutely everything sometimes, but I think here he doesn't need absolutely everything. Okay. Is that clear to you guys? Do you want another example? We could talk about it later if you want, right? The main thing, guys, is don't have this binary thing in your head, right? You can't, it's not just yes, no. It's yes, detail, yes, summarize, no, okay? This is more flexible. And I find that doctors, they get less stressed. It's less stressful to think about it like this. Okay, I think I'm going to put you in groups, but is there any questions about this? Definitely. Let me give you one last example. Okay, I've thought of an example. Okay, so eyes watering. Eyes are bloodshot. Eyes are itchy. I'm writing to an ophthalmologist. Is this number 1 or number 2?
Number 2.
Case notes.
Number 1.
You think that's number 2 for an eye specialist? No. He's probably going to want to know. He'll probably need to. The reader needs all of those, right? Okay. Let's say I'm writing to a nurse who's providing care and support. Right. She's not treating. I can summarize it, can't I? Right? Maybe, right? That's the ideas here. So what you're going to do now is you're going to practice this. You're going to go into groups and you're going to try to select all of the case notes that we require today. Can I ask you guys to write them down? Is that all right? In your groups. Do you all have pen and paper?
Yes.
Yeah.
Write it down because I'm gonna plan it as well. And at the end, I'll be saying, do I need this? Yes or no? And you guys can use your plans. Okay. So let's go in. You've got 20 minutes to chat about this. For each case note, decide, is it relevant and detail, relevant, summarize, or irrelevant? Also, you should decide what paragraph is it going in, right? Is it going in paragraph 1, paragraph 2, paragraph 3? Here we go. The rooms are opening. Try to relax in this bit because you've got a nice 20 minutes. There's no stress, okay? It's not like the exam. Go in there, say hi to each other, start chatting, please. Okay, off you go, guys. And I'll share this. And there we go. Hello, you all right, guys?
Hello, yes, Alan, the room number 5, they are not talking. If you could kindly put me in another room, please.
Yeah, sure. Just do that now. Is that okay? Got you there. There you go, sir.
I haven't got invitation.
I've moved the room. You might have to leave and come back again, I'm afraid.
Okay. I did
Sorry
it,
about
but
that.
that's all right. Okay.
Yeah, it's just, well, it's just Zoom sometimes doesn't like certain computers, so I have to try again, I'm afraid. Okay, let's try again. Does that work? Hi, Bernice. You're right.
Yeah, hello.
Should I put you
I
in?
had an internet problem.
Okay, no worries. I'll put you into one of the rooms here. I'll try this
Okay.
one here, and I'll try Margarita as well. Hi, Margarita. No. Okay, I'll try anyway.
Hello, hi.
Hiya.
Hi.
So, I hope you've had a good chance to be in the rooms. Oh, you've gone. Cool. Hi, you guys. I hope you're all right. Beza?
Yes, I have an trouble with internet connection.
Okay.
So I have to.
It's okay. I'll put you in room 6. Is that okay? Or do you want to go back?
I want to go back actually, but if it's not possible, it's not important.
No, it's fine. Here you go. Should be on your screen. Hope that works. All right, people are coming back into the room. That's great. Just finishing my tea. I'll put my camera on. Just having a slight problem here, guys. One moment.
Enjoy your tea, sir.
It's nice Earl Grey tea.
Which brand?
I don't know actually, but it's the rule is for English, an Englishman is coffee in the morning, tea in the afternoon.
Yeah, 5 o'clock tea.
That's it. That's the one. Okay. See if I can put my camera on, guys. 1 second. I'm just having a few issues here.
Alain, do you know why we are saying Earl Grey to this tea?
I don't know. Do you?
Yeah, I
fantastic.
Yeah, I heard something about that. Yeah, there was a queen in England. His name is Earl.
He was Earl Grey. That's brilliant. Okay.
Yeah. Yeah,
and did he bring it back?
Yeah.
Tell me again. Sorry, we've got a bit of a bad connection. Tell me again.
Me?
Yeah.
Yeah. I heard about that. It's once upon a time there's a one queen in England, and his name is Earl, or his name is Earl, and that's why we are saying Earl Grey to this tea.
What do we think, guys? Does that sound real? Does that sound real? I've not heard that story before, but it's a good one. I really love tea as well. I'm happy to have a conversation about tea. But let's just quickly get this done. Guys, give me some feedback for that. How did you find it? I think it's quite difficult.
It is,
Yeah,
because we have
Furkan as well.
Yeah.
Because everything is associated with lung chest medicine.
We really have to.
It is hard to exclude something.
I think you're right, sir. I think you're right.
Yeah.
What do we all think?
Yes,
There's a lot of relevant stuff.
Yeah.
So
we have to summarize a lot.
we're going to be trying to summarize. We're going to be trying to cut corners as much as we can, but we need to get as much information in there as well for this surgeon, because he has to. What's he assessing? It's not just assessment, is it? What's he assessing?
I think he has assessed the need for a possibility of a lung transplant.
Yes, exactly. So let's come back to this. We're going to make a plan here. And what I'm going to try something new today, if my computer lets me. I've got an interesting way of moving between the screens faster. So before we start, I just want you guys to tell me if this is annoying or if it's good. All right, so watch this. Let me just get rid of this here. Can you guys see this? You'll see my desktop. Can you all see that? It's changed now.
Yes.
Yeah, but you can, hopefully you can see my screen clearly. Yeah, if I move all this stuff out of the way. All right, watch this. See if this works. So get rid of this first. Okay, so if we do have to discuss anything today, if I do that, do you see the case notes?
Yes.
Yeah.
Oh, so that's nice. That's quick. Yeah.
That's better. Yeah.
Okay, so if we do, they are complicated this time, so we can discuss things quickly. Before we start as well, I want to say this. What do OET say that relevant case notes are? What makes a relevant case note? Can anyone tell me that?
Necessary to continue care.
Yeah, we've memorized it. So OET. So what does this mean, guys? This mark here.
Quotation.
Quotation. So it means not my words, OET's words. Okay. So they say relevant case notes are necessary. You can all tell me necessary to
Continue care.
Continue care.
That's one thing they say. If you look at their writing guide, they also say, what do they say? One and
appropriate for the reader.
Yeah, relevant case notes. Case notes. Which one, Emre, if you could tell us which one is the most important here and why?
Necessary to continue care.
Why is that?
Because necessary is, a strong word.
It's very strong, yeah. If I don't have this, right? If I don't have this information, what will happen, guys?
The recipient cannot do his or her job.
So in this case, the recipient, what's he doing? He's trying to assess the not just from the case notes, but he needs to assess, guys, what's he assessing?
A double lung transplant.
Yeah,
like suitable for.
So some things will be necessary for him to do that, right? To do the assessment. See what I mean? Whereas other things hopefully will just be appropriate for the reader. What does that mean?
Understandable.
Maybe.
Might be useful, something like that. So what I like to say to students these days is I say that this one, there are grey areas. What does that mean, grey areas?
Not black, not white.
It's not black and white, is it? What's appropriate? I mean, sometimes you could say all of it. is appropriate, right? But we don't have time. So this one, there's gray areas, right? So that means it may be this, maybe yes, maybe no, okay? But this one, are there gray areas here for necessary to continue care? What's the opposite of a gray area? Anyone know?
Black.
Clear.
White.
Yeah.
Clear. Right.
Apparent.
And let me give you a better word. Gray area, that's a bit informal. Here's the formal word. Fellow, you know this. Ambiguous.
Ambiguous.
The opposite of clear, right? Ambiguous. Yeah. Sometimes. Okay. So with that in mind, guys, let's go through the case notes and make this plan for this week. So I think that the purpose would be, should we say, review here? What do you guys think?
Yes.
Okay, so we're going to say that in introduction. Now, what should we say here? Remember, OET, they say that the purpose of the letter must be clear. The purpose of the letter must be clear immediately. So what paragraph is that?
Introduction.
Right, so OET say the purpose of the letter must be immediately clear. Introduction. So we're going to say review, okay? But then they also say it must be developed. What does that mean, developed?
Expand.
Expand upon. So here, I guess we should say something like assess for the possibility of what?
Double lung transplant.
Double lung transplant. By the way, why is this kid so sick? Does he have, what's his condition?
Cystic fibrosis.
Oh, right. I thought it might be something like that. So it's very sad how bad it is. Okay, so look, in my introduction, I have to say the word review the case. That's what the reader's going to do. That's the purpose of the letter. And at the end, I'm going to expand upon the purpose by saying something like this. Any questions so far?
Yes,
Charo?
I have.
Go on.
Sorry.
Okay.
Which one do we prefer? Is writing all of the relevant things or mind word limitation?
Right. Yeah. Well, that's a very, very good question. Right? Did everyone catch what he was saying there? What do we want here? Do we want a concise letter that's easy to read, that's with good summarizing, or do we want something with absolutely everything that's relevant? I don't think we can have both because there's so many relevant things here. So what do we need to do? Let's let people think about that. What do you think, Charo? Hello?
I think writing the letter with concise, but it should include all the relevant details.
Let's say I put every single down to the last thing, every single relevant detail in. Where am I going to score highly, guys?
Content.
Right. So maybe I'll get my 7 here, right? But what's going to happen if I put, look, it's 400 words now.
Everything is never relevant.
I'll lose here.
Clarity, yeah.
Right.
Conciseness and clarity.
So I tend to think of these things as almost like they balance each other out. You just have to get a balance. There should be a lot of detail, but not so much that it's painful to read. Does that make sense? Okay. So let's think about that in a second. We'll come back to that. So let me just go back to this. Where should I start my paragraph 2, guys? Right. So we've got this here. Oops. 1 second. Let me just, sorry about all the movement here. So we've got this here, right? What's the first thing I'm going to talk about in your opinion? What do you guys think? Where should I start my timeline?
2nd of February.
Is she right, guys?
Yes.
I think so.
Presentation.
Right. All of the dates are relevant. All the dates have important things. So are the symptoms relevant?
Yeah.
Yes. Okay, yes. So do you remember what they were? Severe? I've written it down. I'm going to do this one just because I don't know how to spell it. Is that the right one? Yeah. I don't know if that's the right spelling. And then we've got short, and then we've got, you can't see that?
Yeah,
yes.
Sorry, what about now?
Yeah.
Okay. So severe shortness of breath, guys, give me the symptoms. What are they?
Cough.
Why don't we try and summarize the symptoms a little bit?
Yeah, acute symptoms related to acute. What does he have? Acute.
How about this?
Respiratory
Related breathing issues, right? So I've got this condition. We can discuss this in a second. This is just how I'm thinking of doing it. I'm sorry if the spelling is wrong. Do you know? I don't know how that's to spell. That's a medical word. There we go.
Remove the N.
There we go. So I've put some of them together, right? I've decided that the hypoxia and the other one, I'm going to say related breathing issues, okay? But I'm going to keep fever because I think that's important. What else should we choose from symptoms?
Hemoptysis.
Hemoptysis.
Yeah, let's keep that one. Hemo, again, forgive my spelling. And symptoms, guys.
Hemoptysis, Alan.
Facial pain. Do you want to have that one, or is that covered with breathing issues? I'm not sure. Is that coughing or something?
Yeah, coughing.
So I'm summarizing a little bit. But, fella, the important thing is here. When you write this, you just do it your way. I don't think it makes a lot of difference, okay? But let's just say this for now, guys, okay? Because I'm just looking at some examples. I looked at some example letters, okay? These are all symptoms, and I'm talking about the symptoms at the start of the timeline with a date. What shall I talk about next?
About auscultation, maybe just.
Yeah, so there was, what do they do? Usually the patient, he comes in, he's got symptoms, so doctors, they immediately,
Examine.
they do exams, right? They don't like immediately do operations, but sometimes I suppose. So they're doing exams. What exams? What did the exams show?
So
sonorous wheeze.
Unremarkable.
Sonorous.
Wheeze.
Well, yeah. So we won't mention that. So sonorous.
Wheeze.
Sonorous wheeze.
What does it mean? Sonorous, for me, sonorous means loud and with a good sound. What does it mean medically? Sonorous, like.
It means that you can hear the wheezing even without stethoscope.
Or like that. Oh, okay. So sonorous wheezing. What else are important things the exam reveals, guys?
Bibasilar crackles.
Bibasilar crackles.
Yeah, and then I hate these case notes. So many things that I don't even know what that is. What is that?
It's a sound on the auscultation when you auscultate.
Okay.
It's like a group.
But I'm grouping this around the idea of exam revealing something, guys, okay? And when we write our paragraphs, you'll see the language we use, okay? So wheezing was revealed. These crackles were revealed. Anything else?
Oxygen saturation, 80%.
Oxygen saturation, 80% on room air.
Do we need to mention that? Yeah?
Yes.
Yeah.
Okay, so oxygen saturation. We don't want to go too crazy here, okay? 80%. What else can we say? I was thinking maybe we talk about, don't these indicate something?
Yes. And antibiotic and supplemental oxygen.
Lower respiratory.
Lower respiratory tract infection.
Yeah, well, they thought it might be that, right? But it wasn't or something. So they thought this was, well, what's this thing about, if I move here, guys, can you see that?
Yes.
All right, let's go into a bit more detail here because this is a bit crazy, this one. So
this one is different case note.
Sorry, I put the wrong ones up. Sorry, guys. I planned it all so well, except I have the wrong case notes. Here we go. This one?
Yes.
Yes.
Okay, so we've got the sonorous wheeze, we've got the crackles, okay?
Mm-hmm.
Do I need to mention the sound at the base of the lung, or should we leave that?
No.
Okay, so we're going to go straight for treatment, okay? That gives me a bit of a narrative as well. I like that, okay? It's giving me a bit of a narrative. Let me just put this into the second screen. Okay, so we're going back here. I'm going to put treatment then. Sorry, not indicates. What's the treatment on day one? Day one treatment.
Ampicillin sulbactam.
Ampicillin. Yeah. What's this? Is it an antibiotic or something?
Yes.
Sulbactam.
Do you have to mention the antibiotics or just treat it with antibiotics?
Well, this is the thing. Like, you just ask yourself, is that necessary to continue care?
No.
So it's more like appropriate for the readers.
Yeah.
And you just have to sort of go, how much time do I have? Right? Okay, so maybe you could summarize like that. When we practice writing this paragraph, you can try different things out, guys, okay? But I just want to get the ideas that we know that we really need. Some treatment was done, but then the next day, I think it got worse. Is that right, guys?
Oh, he was stable, but he had to investigate. Investigate.
Sorry, you're right. I wrote some notes here. There were scans. Yeah, there were scans. Okay, I'm not going to go into detail about what they were, but what did they reveal?
SS3 showed pleural effusion.
Yeah, pleural effusion. Again, I have no idea what that is. What is a pleural effusion, guys?
Fluids in the lungs.
And pneumonia.
I know what pneumonia is. I've had that a couple of times myself. And the last one?
Chronic sinusitis.
Sinus. So did everyone choose the same sort of things here? Yeah?
Yeah.
Sinusitis. Okay, so the scans reveal that. What's next?
Ellen, can I ask something?
Please, go on. Questions?
Is it important to say X-ray decided pleural effusion, chest BT, chest CT determined or revealed coronary sinusitis? Yeah,
I don't think
if
so.
The test names are important as a
I personally don't think so, but maybe a doctor can tell me it's necessary to continue care. I don't know. But for me, I'm going to summarize.
Okay, thank you.
Yeah.
Ellen, can I ask something also?
Go on, Emre.
Why we didn't include about his vital signs, and there's an increased breathing rate also. Maybe we can say something like her vitals are unremarkable, except.
Yeah. Was that on the second?
Second, yeah.
Okay, so usually we don't mention unremarkable vitals, but actually for a specialist, it can be important. So yeah, so except for as well, right? Unremarkable. What's the one that was not?
Oxygen saturation.
Breathing rate and oxygen saturation, actually,
Except, this fits nicely here, right?
Yes.
Okay. That's nice because it's making it smaller. That's what I want. Okay, there was antibiotic changes. What were they?
Was changed to azithromycin.
Now, what about this one? This is what do I need all of the per day, this every day? I don't think so. Just names and dosage?
Yes.
Okay, so I'm just going to put names and dosage here. Let's write it down because we're going to use this all week. What's the first name? It's horrible.
Azithromycin.
Azithromycin. Okay, and what's the mg for that?
500 milligrams.
No, it's 250 milligrams.
Was it? I wrote down 500. Okay, so maybe we made a mistake.
500
reduced to. Then reduced to. Okay, so we could, let's just do that. So mg reduce. Oops. These case notes are really hard. I like that though. I hope that's okay for you guys. It's good to do difficult ones, right? Okay, so the next one is
ciprofloxacin.
I've got it written down. Ciprofloxacin.
Floxacin.
Okay, I'll correct this later, guys. I'm sorry about my spelling. I just don't know what that is. Okay, I know it's antibiotic. mg.
500.
500. Anything else you want to put in this para? Are we almost there? No. Very difficult para.
We finished.
I think we're there. Yeah. Okay. So when I was looking at this before the class, I was thinking, this is one of the hardest timelines I've seen for a while. Okay. There's a lot of detail here, but we'll write that one on Wednesday. Okay. And I'll show you some examples before you do. Current condition. What's the current condition here?
In his condition.
Recovery.
Yeah. So I'll say to start off with recovery. So making recovery, what should we say? Well, completed the course. What else should I say?
He's recovering well.
So recovering well, that'll do. Recovering well. And he's sort of ready to leave, isn't he?
Yeah.
Is he being discharged?
No.
From the hospital? What do we think, guys?
No.
Will be, but
has not been discharged.
Yeah, he is. There's a plan.
Mm-hmm.
So he's going home, right? And obviously, is that why they're talking about school?
Yeah.
Okay. Got to be careful with our language. So recovering well, maybe you could say ready for discharge if you want. What else?
Physiotherapy and dietitian were.
Okay, do we need to mention the physio and dietitian to the surgeon for lungs?
I don't think so.
I don't think
so.
Necessary.
And seeing as we have so much to do, right?
Yes.
This is what I was saying before. Like if you put it in and it wouldn't be a problem for me, okay, but it would take a lot of time. Let's focus on this idea of there's going to be an increased what?
Risk of infection.
Increased likelihood of lung infection.
I think I understand that's why they're thinking of this surgery, right?
Yes.
So increased risk of infections, lung infections. What else should I include here? I wrote down a few things. Oh, there's one other thing.
Regarding the reduced time in school and increase in hospital visits.
Yeah, I mean, should we mention the hospital visits or should we mention the family? Is that, maybe that's not relevant. I don't know. What do you guys think? Maybe it's good for this guy to know about his family situation. He's a human being a little bit. What do you think?
It's ambiguous.
relevant.
It's ambiguous. I think it's appropriate for the reader, but maybe not necessary. You could just do a very summarized, like family advised about. He's got some issues now, hasn't he? What's that arrow? Less time in school, more. Okay, so how about this? Have family advised about less school, more hospital.
Maybe homeschooling, advice about homeschooling.
Is that what it is?
Yes.
Yeah.
Homeschooling possible.
Query.
Right, because he's going to be going in hospital so many times. Okay. We could mention it here. We could put it into the background as well. Okay, I'm just going to put family here and I'm going to put this. You guys choose how much you want to put up about that. Okay, I'm just going to put mention. Okay, background. You guys have to help me. You're the doctors. I presume all medical passed? Do we want all of that?
Not all.
What can I choose that I need here?
Okay, the family history of
Cystic fibrosis.
Lung disease, lung cancer by the father.
So lung cancer, guys, help me out. So we'll mention the father's lung cancer. We'll mention the cystic fibrosis. What else should we mention?
I think also the epilepsy.
Epilepsy.
Fibrosis, epilepsy. What else?
Chronic infection, chronic sinus infections.
Yeah, it's all kind of, it seems relevant to me. Chronic sinus infection. Anything else?
BMI.
BMI.
Yeah.
BMI, he's a bit overweight. He's sedentary as well.
Yeah.
Maybe.
Yeah.
Should we say no allergies?
No.
Okay, and sedentary lifestyle. Is it going to sound strange if I suddenly talk about cystic fibrosis here? Will the guy be like, yeah, I know that? What do you think?
No, it's necessary.
Should I mention it at here? Isn't this all the consequence of cystic fibrosis? Doctors, help me.
It's maybe infection in the damaged lung.
Okay, so it's not like directly caused by it. Okay. All right, let's stand back, guys. We did it, okay? We made it. I'm going to end the class in a second. I'll give you your homework, but does anyone have any questions for me so far?
No.
Alan, I have a question.
Yes, go on.
In the request, in the introductions, shall we give a detailed request or a brief request, and in the closing we will give a full plan of the request?
Yeah, so usually introduction should be concise. So yeah, not much information here. Okay. And then more information at the end. That's your question. Do you guys want to write the sandwich for me for homework? The beginning and the end. What do you guys think? Shouldn't take that long.
Yeah.
Yeah. Okay.
I mean, obviously this one's going to be tough, right?
Yeah.
So this is what we'll do. Your homework is to write the first and last paragraph. Okay. And you're going to email it to me. Okay. And then I'll be reviewing them tomorrow. I'll focus on grammar and basics. Okay. Here's my email address, guys.
So you mean introduction and request, Alan?
Yes, exactly.
Yeah, okay.
So first and last paragraphs. Intro. Then what I'll do tomorrow at the end of the class is I'll show you an example of a timeline paragraph for this. All right. And we can analyze it and maybe even criticize it a bit. And then you guys are going to write your own one. Okay.
Sorry, sir.
Yes, go on, please.
he is not adult. He is a child. So we don't say Mr. James Smith. Only James Smith or James.
How old is he again? Is he 15 or something, guys?
Yeah, 15.
15. Okay. It's a bit ambiguous what we use for a 15-year-old. You could probably say Mr. But Chari, I agree with you. It's probably better style to say just his full name, guys. So James Smith, you don't need the Mr. Okay.
I think in the case notes it's Mr.
Yeah, this is what I mean. It's a bit ambiguous. So
Yeah.
actually, you're allowed both. It's fine. Okay.
Yeah.
It's only Chari if he was, say, 3 years old, right? What I normally advise is use the full name, James Smith, and then refer to him as James for the rest of the letter. Okay. But that's a separate issue. It's not a big deal. Okay. So guys, are we all ready?
Yeah.
Yeah. Off you go. Take a photo. If you want to start writing this now, you have the case notes, right? You have the plan. Off you go. Write this. Send me an email, and tomorrow I'll be reviewing your work. All right. I'm going to say goodbye now. Thanks very much, everyone, for attending. Hope you all have a lovely day.
Goodbye.
And I look forward to reading your stuff tomorrow. Bye, guys. Bye-bye.
Thank you, Lynn.
Bye-bye. I'll leave this on if you want to take a photo.